The laughter of grandkids. In an instant, Thomas Campbell feared that he would never hear that laughter again.
I started getting this weird noises, and the hearing just subsided, and then it just went out.
Thomas lost the hearing in his left ear nearly 40 years ago. Now, suddenly, the hearing in his right ear was gone.
All kind of things are just flashing through your mind. You got grandkids, can't hear anything. How am I going to get around? How am I going to communicate? It's pretty emotional.
After seeing multiple doctors who couldn't help, Thomas turned to Mayo Clinic and Dr. Nicholas Deep.
I told him I had a couple of doctors that specialize in implants that can't do anything for the left ear. He just quick looked up and shook his head and said, "That's not true." Just very confident, no hesitation in his voice.
This is a person who was getting by with one ear that all of a sudden was sidelined by complete, profound, bilateral hearing loss. We treat hearing loss, sudden hearing loss as an ENT as an emergency, and so of course we got him right in. We got him a hearing test, confirmed the hearing loss, and started working to rehabilitate his right ear.
But it would take time to rehabilitate Thomas's right ear, and Dr. Deep had another idea.
Meanwhile, his left ear has been deaf for over 35 years, and so I brought up the conversation of a cochlear implant. Those nerve synapses and connections between that ear and the brain, although they haven't been stimulated in many years, they can be revived. I felt confident that we could certainly get him back online.
The surgery itself was less than an hour.
So the cochlear implant has two components, an internal component that we place at the time of surgery, and the external component, which is the microphone that's sort of like a hearing aid, but it sticks on by a magnet.
Implanting the cochlear device was one step. The next was to program the device.
An audiologist's job is to make the implant work. So we are actually determining what sound is sent through the implant in order to get the patient hearing optimally.
Success is about collaboration, says Dr. Courtney Kohlberg, a Mayo Clinic audiologist.
What people should know is that the patient journey is really a journey that we take together.
And for Thomas, it's been quite the journey.
I can't say enough about it, about the implant, about the doctor, about Mayo Clinic. It's been unbelievable. Hearing grandkids again, pretty incredible.
For the Mayo Clinic News Network, I'm Joel Streed.